end of the program. It will help us to know what is helpful and what additional topics you would like to see, which can then be presented as webinars or in our newsletter. Before we get started, just a couple of things. All of your phone lines are muted. You can unmute your phones to ask questions at the end of the presentation. Mute is *6, unmute is #6. You can, if you are online, you can also ask questions through the chat box. We will be recording this program, and the slides will also be available on our website. And again, we appreciate your feedback. So today I'm happy to announce that we are going to be talking about how to be a successful patient advocate with members of your Congress. And I'm pleased that we have two very experienced speakers on this topic to share with you how you can do that and exactly what else you can do and what actions you can take moving forward. One of our speakers is Megan Beveridge. She is the Director of Congressional Relations at our DPC office, where she manages and coordinates all efforts between DPC and members of Congress and their staff. Prior to joining DPC, she served 7 years working on Capitol Hill, most recently as Legislative Director for Representative Jim Renacci. Prior to working on Capitol Hill, Megan was a political appointee for the Bush administration, serving in the office of the Secretary at the U.S. Department of Transportation. Our other speaker is Mike Guffey. Mike is a current kidney transplant recipient, and he serves as treasurer and a board member for our dialysis patient citizens and DPC Ed Center. He also serves as a representative with several additional kidney health-related organizations. And as a result, Mike has been very active in advocacy at both the national and at the local levels. So at this point, I'd like to turn the program over to them. Megan, Mike?
Yeah, thank you, Kathy. I know Mike and I are very excited to be here and kind of go over this very important topic for patient advocacy. And I thought we could start with just a little bit of why is it important to advocate? Why is it important to be a patient advocate? And I know Mike, with his extensive background, has firsthand experience with this. So Mike, if you want to touch on this.
I mean, the most important thing is that you're the constituent, you're the voter, your voice will be heard. I mean, we could send lots of different people in who would be, you know, lobbyists and other things, but you're the person who actually will vote for the senator or representative when they're up for election, and they will be interested in your story. That's the key thing when you go. It's important you have a story to tell. You're going to have a story that's different than my story. You're going to have a story that's different than everybody else's. It helps bring up a human face to what's going on with kidney disease, with dialysis care. Why advocate from a personal standpoint, you want to make a difference for yourself and others. I always tell the story, the first time I was on the Hill, I walked back through the airport that night and saw off to my side what looked like a really, I said, old man walking by, and I realized I was walking by a jewelry store and was looking at the mirror at myself and thought, you know, I think this put 40 years on me, but it felt good. I mean, it just felt good knowing that I'd been on the Hill, I'd made a difference that day, trying to advocate, trying to get our points across with my representative, my senators. You are an expert in dialysis. Again, you can bring people in to talk about it, but you go through it every 3 days a week or more, depending on the mode you're in. You can bring that experience and really bring it home to them. You don't have to be an expert in public policy. Again, it's about your story. It's about knowing the basics and bringing what you know to the meetings. It's really, that's what they're looking for. If there are facts that you don't know up front, a lot of times you can get materials from DPC before you go. You'll have a packet that you can hand out at the end of your visit, but you don't have to know every number. You don't have to know every fact and figure. It's why you have the packet, or you can volunteer to follow up and then tell them you'll do more contact. Like I said, the final reason sort of, I'm sorry, Megan.
Oh, no, I was just going to say, I think it's an important part, just to point out on this. You know, you don't need to feel like you know a lot about other public policy issues. You know, you're going to really be an expert and a voice for dialysis and bring them that knowledge. So don't feel like you need to, you know, maybe study what else is going on, because you don't want to bring up too many other issues. Well, you know, you really want to be the dialysis expert.
you don't want to go into the office and not, I mean, you want to go in the office and speak about dialysis, and that is the focus. I think we stress it every time, and I always remember when you go in the Hill, I don't have a gun policy, I don't have anything else, I'm not going to have an immigration policy. None of that stuff is there that'll take away from your message, and the strength really is, and you want to focus particularly on dialysis. There are other people up there with their stories on the other issues, so focus on what you're there for, what your story is about. And finally, if you don't advocate, who will? I mean, we need to have people up there advocating for patients' rights, for patients' needs, equal treatment. So if I don't go, if you don't go, that leaves a big gap depending on somebody else to try and fill that in.
And so that kind of takes us to how do you get into these offices and speak to your legislators? And it actually is, I think, easier than a lot of people may think. So both congressmen and senators have multiple offices. The congressman will always have an office in D.C. and then at least one, sometimes more, in their district. The senators will have one in D.C., and then they may have several throughout the state. So you have several different places or ways to contact them. To find out the different ways, you can go to their website, which you can pretty much just Google their names, but it's normally kind of their name, I think .house.gov, .senate.gov. And on each website there is all of their office locations, their phone numbers, their addresses, so you can call or write. If you want to call and talk to them about a specific legislative issue, a lot of times it's better to contact the Washington, D.C. office, since they are typically the contact for legislative topics. If you need more casework, if you're having problems with your center or maybe your social worker, or just more specific concerns that you would like their help on, I typically recommend reaching out to the district offices or the state office. But either way, they are easier to reach than I think sometimes people realize.
I found from my side, Megan, that a lot of times when I'm dealing with somebody in Washington, they'll tell me if I'm trying to schedule when they're coming back to deal with their local office. And it's often good to get a local person in to see your dialysis clinic. They may not have ever seen that before, and it sort of gets them in. It lets them understand as well what you're talking about, what your presentation is. So they can understand and empathize with you, understand. It's helped me with both my representative and my two senators with getting on all their grassroots calls and things. I'm on their pretty much on their permanent call list, so when they're having a grassroots call, they let me know or reach out beforehand with it, or call me when it kicks off. I'm on that dialing list, so to me that's a big help with the local office.
Right, and that kind of takes us actually a perfect transition to our next slide, which is kind of the where to advocate and kind of separates the two different sides. I would just stress that it's important to make contact with both offices, whether it's the state or the district, because they do handle things a little differently. Having a contact in the district office where you can really be the expert that they can reach out to if they have questions, try to get the district staff to come visit some dialysis facilities, which I know, Mike, you've been successful in doing. And then also creating that contact in Washington, though. So when you do have a bill, and we're going to talk about several in a little bit, you can easily reach out to those offices and just, stress your support for it, urge the congressman to co-sponsor it. And so having connections in both offices, I really do think, helps advocate for your issue. But Mike, I don't know if you want to talk a little bit about having some staff come out to your facility.
Sure. I mean, the one thing I will say is when you get through and start scheduling it is make sure your facility knows. Don't blindside them with having people show up. And your facility is great working with. I've worked with several here around my area, depending on the needs to be there and be hosted. The best story I have is one of my senators He's been in the dialysis facilities. I've been dealing with one of his aides for 3+ years now in Washington. Every year I go and it's sort of an add-in, please come visit my dialysis facility or my facility where I used to dialyze since I'm a transplant patient now, but I'd like to host you. I promise you it won't make you turn green. We will get you in and treat you nicely. After 3 years this summer, I had one of the senator's staff members who was going to be back here. I developed a rapport with, and he said, hey, I'm going to be back on vacation. If I call you, will you get me into one of the facilities? I arranged it. It was a DaVita facility. DaVita, again, helped me set all that up. We had a great visit in the facility. He was supposed to be there for like 45 minutes, stayed for almost 2 hours with us, was late to his next appointment. But it's a great way to do it.
Yeah, and I want to stress, kind of as a former staffer, how important those visits are, from our perspective too. I mean, I think, if you don't invite them out there, no one else probably will. And a lot of times, these staffers may not have had any kind of awareness of or relationship with dialysis. So seeing that firsthand, I think, really can be helpful for a lot of people. So I would always highly recommend, just if you have these meetings, always, feel free to invite them. I think it is helpful.
And for the actual member, it's helpful because they'll have, basically they have, as everybody knows, a captive audience. They'll come into the clinic. They can come in and meet people, shake hands. The representatives are constantly running for re-election. The senators are almost constantly running for re-election. So to them, it's a great way to get in. They will be happy to come through and see. Again, there have been a couple of times when I've hosted at an office other than my dialysis clinic, other than my own, because of some of the demographics of where they wanted to go meet the audience. But they are great about coming in and seeing it if they have the time.
Yeah. That kind of takes us to just a couple last little pointers I think we have. And that's really just be confident. You are bringing them information that they probably don't already have, so be confident in that and, very aware of that. And, we know you're stepping out of your comfort zone. I mean, I know it can be sometimes intimidating to go in and meet with these offices, but, you are the patient voice, and they need that knowledge, and they need that perspective.
Yeah, I think early on when I was doing one of my first Hill visits, we had an outside speaker who came to one of the kickoff meetings and said one of the things that they like to do when they go on the Hill is have sort of, keep that some sort of theme song, whether it's Rocky, it's some sort of an upbeat song in their mind. Just sort of keep them buoyed up, keep them sort of get that bounce in your step when you go in there. And it is easy as long as you aren't driving yourself crazy, whatever that song is for the day. But, get a little bit of that swagger in. Be good when you meet with the people. Follow up with them. Tell them how much you appreciate the help they give you. But don't be afraid. Stick your hand right out and meet them. Right.
And that just brings us to a couple last little tidbits. And, I know you really need to get in there and kind of have maybe a little bit of your talking points laid out, or how you make sure you hit on all the important things you want to talk about. So we just put up a couple ideas to things you should make sure to bring up with these offices, and that's your story. You need to tell them your story. How did you lose kidney function? How long have you been on dialysis? Which modalities have you been on? How has your condition impacted you economically, personally, professionally? I think this is very important because, this really will hit home the impacts that it's had on you, your family, and everyone else. Have you been able to access a supplemental plan to help with costs? I think cost for dialysis patients is a huge burden that a lot of other patient groups may not have, at least as bad, but they need to know that, and that touches on some of our legislative priorities, which we'll bring up in a minute, but bringing that perspective is extremely important. And then finally, let them know why you wanted to become an advocate. And Mike, I don't know if you want to touch on, what got you so active, but.
I mean, I got involved because, again, I mean, when I lost my kidney function, I was on vacation. I crashed into dialysis. I had absolutely no warning. In fact, I found myself in the emergency room in a hospital in Arizona. I knew nothing. I heard all these people telling me all these alleged facts and things. I needed somewhere to figure out what was really going on. I found the DPC and was recommended the DPC website. That got me really interested in it. When I was back at work, I worked full-time. My company actually was encouraging us to have volunteer time and volunteer for something meaningful, and I sort of backed into being with DPC as a result, using my volunteer time with DPC, and I've been involved ever since, which is going on 8 or 9 years now. So, I mean, that was my original, but like I said, I know not everybody can get to D.C. I'm glad to be in D.C. I'm glad when I'm here and can meet with the office, just because I know I'm helping represent other people who don't have that ability.
Right. No, that's awesome. And then, like I mentioned, there are kind of 3 main legislative priorities right now that we have been working on that we think would be really important for dialysis patients. The first one, which has been kind of gathering the most traction, is H.R. 4143, or S-2065. And just for background, the H.R. Is a House bill, where the Senate, the S is for Senate bills. They have a House and a Senate companion. And that's the Dialysis Patients Demonstration Act. And then we have H.R. 3976, which is the Access to Marketplace Insurance Act, and H.R. 2644, or also S-1890, the Chronic Kidney Disease Improvement and Research and Treatment Act. So I will go into just a little bit of information on all of those. H.R. 4143, also S-2065, or the Dialysis Patients Demonstration Act. This was introduced by Representatives Smith, Blumenauer, McMorris, Rogers, and Cardenas, as well as Senators Young, Nelson, Bennett, and Heller over on the Senate side. And right now it has 144, although now I believe it's actually 146, co-sponsors in the House and 7 in the Senate. That is a huge number because that 144, that is a bipartisan group of members. And so considering this bill was introduced, I believe, in November, the fact that we've been able to gather that much support is actually really impressive, and just shows, you know, what good legislation it actually is. So this bill would set up a 5-year demonstration project to allow the dialysis center to coordinate a lot of the care for the patients. And so what is care coordination? You know, right now a lot of these patients do have other comorbidities, whether it's, you know, cardiovascular disease, diabetes, but lots of times they are seeing, you know, multiple specialists and receiving multiple prescriptions. So care coordination would bridge the gaps that may exist in those cares, whether it's a lack of communication between the providers or maybe the dialysis center and the hospital. But we think by, you know, increasing that communication and coordinating more of that care, ultimately, you know, the care for the patient will improve. And so, yeah, there's some examples on this slide. You know, it would close the gap between renal care and diabetes care, the hospital and the dialysis clinic, or just between, you know, your multiple treatments. And I think I mentioned this, you know, it would allow them to manage their prescriptions. This is a huge priority for Medicare because it would substantially bring down the cost of treating these patients, mainly by, we believe, reducing the hospital readmission. So I'll go to the next one. And so this bill basically sets up a new model for care coordination for dialysis patients, where the centers, as I mentioned, would manage the medication, manage the multiple comorbidities, increase communication, and then with the cost savings that we believe this coordinated care will produce, the dialysis center would then be able to take those savings and put it into providing more services for the patient that Medicare does not currently cover. Some of the ones we think would be really important are dental care and transportation services. I think a lot of times if a patient doesn't necessarily have access to public or private transportation, they may take an ambulance. So by allowing the dialysis center to provide transportation, that too should hopefully cut back on a lot of costs. One of our second bills that we've been working on is H.R. 3976, the Access to Marketplace Insurance Act. This bill was introduced by Mr. Kramer from North Dakota, and it now has 89 bipartisan co-sponsors, which is also a very strong sign of support. And this bill would prohibit insurance companies from rejecting a patient's ability to use charitable assistance to purchase private insurance on the individual market. Charitable assistance is a tool that is very important to dialysis patients, so we want to make sure that their ability to use that is protected. For a long time, nonprofit organizations have provided that assistance. The main one, as you know, I'm sure, is the American Kidney Fund. But private insurance companies have been starting to push back on a patient's ability to do this. I think ultimately, the insurance companies are basically saying if you qualify for Medicare, then you need to be on Medicare. Because dialysis patients can be costly, I think they want Medicare to, cover the cost of care for patients. But it's important to us that we just maintain that ability for patients to use private insurance if that is what they choose. And one of the third bills we're working on is H.R. 2644, also S1890. And this is the Chronic Kidney Disease Improvement and Research and Treatment Act. This bill was introduced by Mr. Marino of Pennsylvania and Mr. Lewis of Georgia. And it would, among other things, it has a lot of different components to it. A lot of them are educational. But one provision which we think would be very important for patients is it would ensure that all ESRD Medicare beneficiaries have access to Medigap plans. So right now, I guess I can explain what Medigap is first, sorry. Medigap policies are kind of standardized private insurance policies. They're supplemental that you purchase to go along with Medicare, and they help cover things that Medicare doesn't cover, such as some of the co-payments and deductibles. And right now, if you are an ESRD patient over the age of 65, you have access to Medigap. If you are an ESRD patient under 65, you may have access to Medigap depending on what state you live in. And so I believe, this shows the states, obviously across the country. And the ones in red currently allow ESRD patients under 65 access to Medigap. The other ones do not. And we think this is an extremely important issue because, a lot of times if you want to receive a transplant, you will have to show that you have some kind of supplemental or maybe private insurance, or sometimes you'll have to show that you have the ability to pay for the drugs post-transplant in order to receive that transplant. And so, access to Medigap we see is huge for patients because it, basically leads to access to transplant as well. And so we touch on this again. Why do they need Medigap? ESRD patients require either dialysis or a transplant to survive. Both are costly, and without a supplemental coverage, as I mentioned, Medicare patients can bear a significant out-of-pocket cost. Medicare, I believe, only covers 80%, so that would leave the patient with the other 20%, which the supplemental would help cover. Here's another example. ESRD patients faced cost sharing of over $7,000 per year on average, and they face many additional out-of-pocket costs, physician visits, hospital admissions, all of which a Medigap policy would help cover. And so we think that this obviously is life-saving and an access to transplant issue. Some of the other provisions in the bill, it would improve the lives of those suffering with kidney disease by identifying some of the barriers for transplantation. It would promote access to home dialysis treatments, and it would also seek to understand the progression of kidney disease and the treatment of kidney failure in minority populations, and improve access to kidney disease treatment for those in underserved and rural areas. So all of those we think are also very, very important. So those are the three main, at least legislative priorities that we kind of here at DPC have been advocating for. I would strongly suggest, you take some of the advice we gave you at the beginning of the call and reach out to your congressman, whether it's, like I said, by phone or email or letter. You can request a meeting with the representative staff. I don't know if I think I forgot to mention this, but you can often through their website request a meeting. So I would highly recommend just submitting that request. If the congressman or senator isn't able to, a lot of times the staff will still do it. So I would absolutely submit that meeting request. And then, yeah, as Mike has touched on, and I'll kind of let him close it up, keep in touch with staff, be an advocate. They need to hear from you, and they need your perspective and your counsel. So, Mike, do you want to touch on any of that?
I think it's easy. It's fun. I think I'm here now. Sorry, I had my phone muted on my side. I think it's important. It's great. I've warned the representative staff, the senator's staff since I started. You're going to keep hearing from me, and I'll be back in person next year, at least once a year, to see you when we fly in. But I keep the rapport with them. And one of the senators I started with, it was his first term in Congress, very early in the term, and he was in a bad office section in the Senate offices, and his aide and I sat in the hall, and I was struggling. I'll be honest, I was struggling for the day, physically a little bit getting through it. It was the last meeting, but that representative remembered me. We stayed in touch. He would email questions. We continued to stayed in touch for 6+ years that he was with the senator. I now have represented with my other senators, been there 3+ years, and I keep in touch with them. I'll answer questions. I'll refer them back to Megan, to whoever else I can get to help them for stuff I don't know the answers to, because I've got access to the expertise. I don't want to make things up and lose my credibility, but that to me is important. Build the rapport with them, have them know you, turn to you if they've got dialysis questions or hear something new.
Right. And Mike, did you have anything to add on either, care coordination, charitable assistance, or Medigap, or any other priorities?
They're all important. I mean, my situation was a little different because I did work and I maintained my secondary coverage. Right. But I think they are very important. I've met with some of the other groups with the people from the American Kidney Fund. I think it's important to note that there are a lot of rails put in place to make sure that funding is not, it's pure funding. It's not money being funneled somehow from the dialysis company just to take care and raise their profits, which occasionally the insurance companies like to say. That's all three of these bills serve very important functions for dialysis patients. So I can go in and do it. And if your senator won't support all of everything, some of it's interesting is a lot of times if you know your Senate sort of study and you know your state, is to cater some of this to what your senator does. I come from a rural state. I mean, I can always push on the telehealth, anything dealing with the rural. My senator's ears perk up.
Right. No, that's a great point. Kathy, should we open it up for questions?
I'm going to jump in quick. I saw that there is a question in chat, well, actually two. One, Thomas had asked how to contact the legislators, so in the chat box, if you are online and can see the box, I included the link to our Kidney Action Center of sorts that has all 3 issues listed that allow you to take action. And actually, now that I say it, I want to make sure it's .org, not .com, and it definitely is. So if you visit www.kidneyaction.org, it'll take you to a page that has all 3 issues where you can send messages to your legislators. But then the second question came from Michael, and he wanted to know if there were any coordinated efforts to approach senators and representatives, and how are they organized? So it sounds like he's asking sort of how do folks get to D.C. So I don't know if either of you would like to talk about sort of the Advocacy Day fly-in process, or if you'd like me to.
I mean, if you want to, I think that's good, but I think it's important to, just point out that, whether it's through DPC, there are a lot of groups that do bring, different advocates in here, and I know, we have a whole application process that you can fill out, and then we try to get representatives from, a broad area. So I think, we're hoping to get, hopefully around 30 states represented coming up in our next fly-in. So, if you live far from D.C., don't think that excludes you from needing or, wanting to come here. So I don't know, Christy, if there are... Yeah.
I mean, it is important to go to the kidneyaction.org, fill out those, follow with some of these meetings that we have, the monthly meetings. I mean, Christy will send things out where you can report back what you've done, and that also helps get you some points for when it's time to sign up for the fly-in. Stay active throughout the year, and that will help with getting people on the fly-in, because this year we had a record number of people apply for spots on the fly-in.
Right.
Hey, this is Kathy. Yes, we do want to check if there are any other questions, either over the line or through the chat box. And Megan, can you tell us how people can follow, if they want to follow when something goes from the House to the Senate, or how they can follow the progress of a bill?
Sure. I mean, the thing that I use the most is, I believe it's the Library of Congress, but it's congress.gov, and if you go there, you can search any legislation, and it'll give you kind of the status of it, whether or not it has a companion, how many co-sponsors it has, and so you can track a bill that way. You can also search by who the member of Congress is. So if you just know, for instance, that it was Mr. Marino that has the kidney bill, you can search for it, by the member of Congress, and you don't necessarily need the name or the number of the bill as well. So I prefer congress.gov. I think that's kind of the easiest and kind of the best format as well for tracking some of that.
Okay, thanks. Any other questions out there?
I'm going to go ahead and pose a question. Sure. Either Megan or Mike, and I might have missed it, and if I did, I apologize. I guess what has been your experience in like the most successful meeting, or the most successful even contact with your legislator? In Mike's case, if it wasn't necessarily in D.C., what things stood out that made that touch a good, I guess, interaction, and something that could start creating a meaningful relationship?
I mean, from my side, I mean, there are two things. One, I went to one of my senator's offices for the first time and was talking to him, and had asked him, went through the usual invitation to a dialysis clinic, and he said back to me that, he'd love to come see a dialysis clinic in my area, but unfortunately he also had been in a dialysis clinic for a number of years because his mother-in-law had suffered from kidney disease. So he understood, and he let me know that he understood quite a bit about kidney disease. He was very receptive to our causes, and certainly where possible aligns with his votes for it. That means positive. Like I said, the personal touch is always a very positive thing. Again, I worked with the aide for my other senator for 3+ years, and I worked on getting him into a clinic and had him here, and when we spent good quality time, he asked a lot of questions of the patients, a lot of questions of the staff. I've talked to him 2 or 3 times, emailed back and forth with some additional questions he had after that fact, and he seems much more engaged now. So that, to me, is an important thing, that he really understands what the patients are going through, understands that they're people, just like him, just like me, just like everybody else. But that, to me, is it. It's sort of bringing the personal touch into it.
Yeah, and I think from a former staffer perspective, what was most useful for me was absolutely hands down the visit. Getting out there and really seeing, the different facilities. I mean, I remember when I went to one, I was completely taken aback by the water filtration system, because that was something I hadn't really thought about, that they would have to, just have these really, complicated and impressive systems to filter the water. So I think once you get out there, you really get to see things that, maybe you just haven't thought of. I think the other thing I've always found really helpful is just the occasional reach out. Once we had an initial meeting and they had my contact information, just occasionally reaching out and saying, I don't know if you saw, but, this bill was introduced that I kind of talked about when we met, and just, keeping me up to date on what was going on with some of the issues, because, as a staffer, and especially on the House side, you'll have one person that's handling multiple issues. I think when I worked on the House side, I did healthcare, transportation, defense, foreign affairs, veterans, a bunch of others. But so you want to help them track your issue, if that makes sense. So that was the other thing I found really helpful, was just someone, just occasionally, not too often, reaching out and just getting me an update on the status of where things that we had talked about were. That was always really helpful. Any other questions?
That sort of brought another question to my mind. Do you find that phone calls or letters through the mail or emails or social media, is one approach better than the other? Do they all seem to work? How do you
I think it's different things for different people and different offices. I think some of the newer offices are very, very active on, the more social media platforms. Some of the older offices just, aren't quite there. I think, at least from my perspective, I always prefer to email over phone calls if you're just trying to get in touch with me. But again, I think that's, kind of up to the person in the office. But I always think email is the safe bet, if that makes sense.
Okay.
And one of the things that doesn't hurt, when you're, especially with establishing rapport, is, especially if you have a really good meeting with a staff person who really listens, spends the time, is to follow up not only with an email back to them thanking them for the time, but also send an email directly to the senator or the representative. Tell them you had a really great meeting with their staff member. We're really appreciative of the time they spent with you. The staff member, if you send something to them nice, is probably going to take it to their boss, but it's nice for them to also have their boss come to them and say, hey, I got a really great letter today from one of the constituents, really appreciating the time you spent, the fact that you listened. I did that after our Hill visit, and certainly thank Senator Roberts for having his aide come in on his vacation time and do the tour and spend extra time with us. And I think that helps further and deepen the relationship.
I totally agree.
Yeah, what a great suggestion. Okay. Thank you both so much for sharing all the information and the tips and some things that are currently on the table. I think if there's no further questions, we will close. I do want to let you know again that we will have the recorded session online on our website, and you will also be able to get resources as well. Another reminder is that next month on February 22nd, we will have our next webinar, and it's What's So Funny About Kidney Disease. We will have a nurse and a psychologist discussing the topic and the health benefits of laughter and humor. So we hope you'll join us again next month. And thank you again for everyone who's attended today.
Thank you.